The new brain, utilizing a liquid hard drive for the brain to address cognitive impairment. According to the CDC, cognitive impairment is when a person has trouble remembering, learning new things, concentrating, or making decisions that affect everyday life. Impairment ranges from mild to severe and may be present at birth or can occur at any point in a person's lifespan. In understanding the impact of cognitive impairment, it is estimated that 1.2 million people are diagnosed annually, and between 13.3 and 16.1 million individuals are afflicted with the disease. An estimated 13% to 16% of United States households may be dealing with the burden of caring for a loved one with an adult-onset brain disease or disorder. There are a number of causes of cognitive impairment which are listed here. The target population for a wet computing product includes any individuals across the lifespan continuum with irreversible cognitive impairment. Treatment for cognitive impairment is currently palliative. Current treatments include medications, occupational therapy, environmental approaches to treatment, cognitive behavioral therapy, alternative and complementary medicine, and inpatient and outpatient services are also utilized. There are no specific competitors for wet computing identified. Some competitors that do exist in relation to advances in cognitive impairment treatment include drug companies, inpatient and outpatient facilities, other treatment programs, and researchers of cognitive impairment. Wet computing is the ability to make use of biocompatible nanoparticles suspended in water to implement in the brain for use. In theory, a spoonful of water containing nanoparticles could store up to a terabyte's worth of data. Wet computing has the potential to assist the human brain in accessing stored information, especially in the cognitively impaired, enhance calculation computations without the need for a calculator, and increase in faster learning and absorption of information. Other potential uses of wet computing include the use of active and passive sensors. While guidelines for a wet computing product have yet to be fully explored and written, the following agencies are key players in shaping product implementation guidelines. The Food and Drug Administration will require manufacturers of wet computing to submit pre-market notification of the product, complete approved clinical studies, and submit product and supporting information and testing for review. The Affordable Care Act requires the manufacturer to plan for a medical device excise tax of 2.3% of profits. When a product enters the hospital realm, the Joint Commission requires hospitals to keep a written inventory of medical equipment, maintain and test equipment, and identify activities and associated frequencies of equipment use. Guidelines for use of wet computing devices once a patient enters the hospital would need to be considered. Finally, state and local guidelines and regulations may play a role. While actual costs are yet to be determined, the following information serves as a basis for the estimated costs of wet computing technology. For cognitive impairment, the current mean medical cost ranges from $6,000 to $11,000 per individual per year, with annual direct medical costs as high as $215 billion. The total cost of cognitive impairment is projected to increase sixfold to $1.2 trillion in 2050. This increase is related to an increased life expectancy of Americans in the aging baby boom generation. With these alarming projections, wet computing nanoparticles may serve as a potential answer in treating cognitive impairment. The breakdown of estimated costs are listed here. Overall, the estimated total cost of one nanoparticle is $688 per reaction, or $8,256 per tablespoon dose. Utilizing previous figures, the total cost of wet computing per year could be $9.9 billion. A cost savings as need for services also decreases. Other benefits include improved cognition for individuals, the potential for improved memory recall and the ability to take ownership of one's own health care, reduced caregiver reliance, and reduced demand on medical services. The bottom line suggests that wet computing benefits outweigh the costs as the overall need for services decreases with improved cognition. Wet computing is currently in the research and development stage. In order to implement this device, it must first be reviewed by the FDA. Additionally, the manufacturer must register their organizational facilities with the FDA, list their device with them, and follow FDA general controls requirements. The manufacturer is also responsible for conducting clinical studies and submitting a pre-market approval application. Overall, the manufacturer must show evidence of reasonable assurance that the device is safe and effective. Additionally, the manufacturer should perform a comprehensive medical device risk assessment and evaluation applying human factors engineering, which considers users of the device use environment, and the device user interface. Monitoring and controlling for identified risks and ongoing surveillance and documentation is needed to continue to monitor for hazards throughout the life of the product, and documentation is needed as proof of this surveillance. There are currently no policy and procedures for wet computing identified. However, the following policies and procedure changes should be considered for development. The manufacturer must have a formal process for the documentation of ongoing surveillance and maintain policies and procedures for determinants of device quality, use, and design of the device. They must comply with the Safe Medical Devices Act of 1990, which sets reporting requirements to the FDA in the event of device-related deaths, serious injuries, and malfunctions. Other considerations include policies for safeguarding information in a digital age that address the security of stored information and how the information can be protected from potential hackers, patient safety with regards to device malfunctioning, and procedures for unknown long-term ramifications, and policies outlining how caregivers and providers can recognize when a device is malfunctioning. Ways of measuring efficacy of wet computing requires compliance with safety standards such as those set forth by the International Electrotechnical Commission and to ensure ongoing post-market surveillance of device safety and effectiveness with post-market clinical studies. Other initial outcome measurements include patient-improved cognitive abilities, improved quality of life, and reduced caregiver burden. Caregiver and provider involvement will be a required role in the monitoring of the device. The marketing strategies include communicating to the target market individuals the benefits of wet computing, such as improved cognitive function, recall, and independence with self-care activities. Other strategies include creating a customer-oriented channel of communication to increase comfort with the product, pricing the product competitively based on alternative solutions, and being a market leader in comparison to other competitors. In summary, key marketing selling points of wet computing include improved quality of life, reclaimed independence, increased intelligence and brain information capacity, faster learning ability and computation, reduced caregiver burden, and bonus sensor functions that increase health safety and alert users in areas such as daily health measurements, developing health problems, and surrounding environmental concerns.